A lot of people thinking about neurological function and Alzheimer's and degeneration of the brain have actually focused on what they think might be a linear approach, which is that, as with hay fever, if you meet pollen, then you'll get hay fever. You deal with the pollen and there's no hay fever. But this isn't anything like that. It is a network-based approach, and there is no way that it can be considered as a single entity producing a single outcome. And it's probably partly why the management of the drug-type management of Alzheimer's hit a number of snags, and they've actually had a 2-day conference in Edinburgh this week saying that the last trial that they've just had has unfortunately failed because they were thinking of one drug doing a job. So medicine, in my opinion, is very rarely a single linear thing. It's practically always a combination of factors which together can stress the body's normal mechanisms. And part of the reason why I can be so confident of saying this is because we have lots of mechanisms in the body for compensating. So if one thing goes wrong, then the body makes an adjustment, and then there's a compensation. And then you have another part of the system taking up the slack. And this is, of course, quite right, because there wouldn't be survival if there were one thing causing an irrevocable change and you can't reverse it. That would happen with some things. I mean, for example, cyanide or something like that. But in general, in the course of living, one has to have the body making adjustments the whole time. So the adjustments can themselves be partly corrective, but they also are stressing a different system. So one has to be able to make correct readjustments of these factors. So, for example, if we're talking about understanding the risk factors for memory loss and whether memory loss can be reversed, I can tell you that it can. Because we've had patients who were very handicapped. One that will be well known to Dr. Shah and Dr. Julu, who was very handicapped. He didn't say anything very much. He just used to sit about a lot of the time. And with a lot of treatment, particularly with oxygen in his case, he improved, and I was delighted to see that he was able to walk down to the town and do his own shopping and things, which would have been completely impossible 6 months before. And also a lady who came in to us who was holding her husband's hand, and if you talked to her, asked her questions, she would look to her husband to answer because she didn't know what to say. She hadn't got the cognitive strength to be able to respond properly. And she now breezes in. She said, "Oh, I think I'm about 80% better. Can you do the other 20% for me?" And I think that it's very unfortunate that there is this attitude that one has to be completely handicapped without making attempts at a whole group of things to adjust for the person's benefit. So, just to let you know that we have to think in terms of all sorts of different areas of the brain, the grey matter and the white matter. The grey matter is on the outside, and the white matter is taking all the strands of neuron, the axons from neurons into the body. And it's the vascular supply we have to consider, we have to consider part of the middle of the brain called the hippocampus, and within that the dentate nucleus. Then we've got to consider the circulation and the blood-brain barrier, which is, we had been told, is impermeable. Nothing gets across into the brain. Well, that's clearly not so. We have to get nutrients into the brain. But there is a blood-brain barrier, and it can be weakened by some chemicals in particular, but it can be strengthened. And then we have to think about the actual cells in the brain, and one of them is the microglia, which actually are sort of immune cells clearing up things. So the brain anatomy, this is from Netter's Atlas of Anatomy, from which we've got permission to print these pictures, because Dr. Julu asked and we got the permission. So this is just the different lobes of the brain, which looks like a walnut, as you're probably all familiar with. But the different lobes have different functions. And the frontal lobe is particularly vulnerable in Alzheimer's, but also the whole brain area shrinks. So we've got a big problem with describing it as a single lesion, which it isn't. And this is just again from Netter, and you can see very clearly the outside grey matter, and this bit is the white matter. But we're especially interested also in all these inner parts here, which link up with the stem of the brain, which goes down into the spinal cord. And this is what's called a coronal section, which is done this way. It's showing here particularly the hippocampus and the dentate gyrus, which are all associated with memory. The brain is very importantly fed by blood vessels, and nature has been kind to make sure that we've got enough blood vessels. If one of them gets blocked, then there's another one that can be diverting blood to a certain extent, and this is called the circle of Willis here. And we've got quite a lot of blood supply to compensate to a certain extent if there is any inadequacy. So if we now think about cognition, the Centers for Disease Control and Prevention have said that cognition is a combination of mental processes that includes the ability to learn new things, intuition, judgment, language, and remembering. And cognitive impairment is not caused by one disease or condition, but Alzheimer's and other dementias and conditions such as stroke and traumatic brain injury can also cause cognitive impairment. And there are a lot of causes of cognitive impairment that are related to treatable health issues. For example, quite a lot of people have cognitive impairment because they're on too many drugs. There are a lot of people who have a polypharmacy of drugs for different conditions, and we have to be aware that often some people just take all these and they don't know that they can have interactive effects. So what one has to do is to always consider what drugs are being taken. And then vitamin B12, we've put here deficiency. In fact, it shouldn't be deficiency, it should be sufficiency, because vitamin D deficiency is very closely defined, whereas, and if you measure the amount in the bloodstream or in the urine, very often there is enough. But what's enough? We need to have a superfluity quite often for it to be working properly, and I'll tell you why. But also there are sort of psychological causes, like depression, when people's mood has altered to the extent that they're not functioning. And it's a major concern of the aging population. It's 30 million people affected globally, but that was in 2014. They've upped this to about another 10 million, they've said. They estimate. So it's a lot of people with cognitive decline, with Alzheimer's being the principal one. Now, what happens in the brain in a person with Alzheimer's, there's a protein there which is called a prion protein, and this folds itself wrongly, and you get some insoluble collections of substance called amyloid B protein, which is AB, and this is stuck in plaques which form between the nerve cells, the neurons. And this builds up in the blood vessels of the brain. And then you also can have abnormal deposition of another protein called tau protein in the nerve cells. So these are just words, but what it means is that these proteins are not behaving properly. That's one of the things that happens. And the misfolding of these is an early driver of Alzheimer's. And it may precede the onset of dementia by over a decade. And just to have an aside, because I will have small asides throughout, we can measure by a decade somebody who has the propensity to develop Alzheimer's, because their smell sensation deteriorates. And we can measure it. And Dr. Shah here has done this, and it's all in the public domain, that in fact 10 years before anyone has any cognitive decline that's observable, you can see it. And it's because some of the functioning of the nerves, which can be assessed between the nerve and the area of the brain which perceives the sense of smell, is impeded. And we can measure this, and we have done it for people, and then we've given them a treatment program and done the test again, and it's gone. Isn't that so? Excuse me. So between one nerve cell and another is an area called a synapse, and in this, it's not a direct connection between a nerve and another nerve. It's actually a sort of fluid connection into which things are secreted for information to be passed across. And you can interfere with the information being passed from one neuron to another. So what we like to do is to try to see if there's any similarity in what happens with these synapses and what happens elsewhere in the body. But if I just give you an example, when somebody has, say, osteoporosis, it means that the amount of calcium in the bone is less than there should be. But in the bone, you have always a constant process of breaking down of the bone and clearing away the old bone and making up of a new bone. So it's called osteoblasts, which make the new thing, and osteoclasts break down the old ones. So there's always a turnover and repair process going on. And this happens in the brain. So the balance between the two systems that we have in the brain, the breaking up and building up and breaking down, has gone slightly wrong. And it can be because there are lots of things that can help. Things like estrogen, melatonin, which is a hormone that's produced in the body, which senses the hormones that are needed, exercise, vitamin D, herbs like curcumin and ashwagandha, and this network-based approach, rather than a single target approach, is what we know, because there are all these different ways in which one can have intervention. So the network-based approach, you have to consider these amyloid, AB oligomers and tau, and inflammatory mediators. Any inflammation is always not so good. And we have to think about the fats and proteins in the brain and in the blood, and all sorts of hormonal mediators, and trophic factors and their receptors, and calcium regulatory pathways, and transport machines, and these neurotransmitters and the prion proteins. So this is from a chap called Bredesen, whose name I've put down here. Bredesen produced a fantastic paper in 2014 in which he'd taken a group of patients and reversed their Alzheimer's. It was 10 patients, but that's enough to make an impact. And he was considering all these factors in them, and he was quite right, because you can't have it a single factor. So in our brains, we have to think about small strokes. A big stroke would result in a big area of the brain being affected, and then the body on the other side has a weakness of the limbs, or might have a problem to do with sensation, and the nerves that are supplying that in the white matter are not able to pass information because that bit of the brain has failed to work because of a stroke. But it would be a big patch of the brain that's lost. And in general, some people have multiple tiny strokes, and these may not appear as a big weakness like an arm and a leg. And there can be multiple white matter lesions in the white matter, which is where the nerves are all being distributed down to the body. You can have this being affected. And in the different areas, the vascular areas, you have to think of other things like strokes and blood pressure, which we've been talking about, but also trauma and diabetes and infections. And the pathology and dementia after brain trauma is well known. We all know about boxers becoming punch drunk. These are really a traumatic encephalopathy. And I'm just going to emphasize this because when somebody has struck on the head or has a big whiplash, the base of the brain is shaken to and fro. We've got a very good protective part, which is the skull, but the base of the brain is where there's a hole at the bottom of the skull, and through that goes the spinal cord. And if that is joggled very abruptly, you can have an impact on what's called the autonomic nervous system, which is at the base of the brain, and that will result in disturbances of function in the body. So, I showed you the dentate gyrus and the hippocampus, and this is overlapping a little bit into my next talk, because this is saying that it's possible to do an MRI scans of the brain and cognitive testing, which means you're giving somebody a little exercise saying, can you subtract 7 from 100 and carry on doing that, or other simple exercises. And if they're simply flummoxed and can't do it, we can do an assessment from this to see what sort of intellectual function they might have. And we know that when somebody has a shrinking of the part that I showed you was the dentate gyrus and dentate area, then people's memory begins to fail. So what they did, and this is absolutely lovely paper showing that you can eat chocolate and improve that bit of the brain. So they gave everybody in one group a lot of chocolate to eat, and the other group didn't have chocolate. And then they looked at their intellectual function and looked at this part of the brain, and they found that the dentate area expanded. So this can enhance blood flow to the flavonols, and it can increase the dendritic spine and capillary density too in the dentate gyrus. So a lot of things can be looked at for their particular function. So I'm saying functionally, we know that the dentate nucleus and the dentate area is important for memory because it's been shown that this is improved. And in fact, one of our very charming members of staff who was here for a long time, Alina, who's a nutritional therapist, went off armed with this information, and she's done her master's on just this subject and just completed that at the end of last year. So they always say that the brain is protected by a blood-brain barrier. And this barrier is supposed to be protective to not allow all sorts of chemicals and things to cross into the brain from the bloodstream. But it's an imperfect barrier because we need to be able to get some things across that we need for nourishment. And we also need to be able to clear away things from the brain. So certain cells in the immune system can produce enzymes which dissolve the matrix, the sort of glue between cells. And when white blood cells destroy invading organisms, there are all sorts of chemicals released which are called free radicals. And we know that the blood-brain barrier is broken by organophosphates, which were used very widely in the Gulf War, for example, or by farmers who were spraying. And also we know that some people who have got lymphocytes which are very sensitive, they show sensitivities to foods and they show sensitivities to chemicals, they have a weakened blood-brain barrier. So it's possible to treat them for their sensitivities and their blood-brain barrier gets more intact. One cause of blood-brain barrier weakness has been shown to be thiamine deficiency, which is vitamin B1. And we know that when people are alcoholic, for example, and drink all the time and don't take any vitamins and don't eat, they get vitamin B1 deficiency, and they get a condition called Wernicke's encephalopathy, which almost resembles Alzheimer's. So another has been a deficiency of certain essential fatty acids, because essential fatty acids are fats that we have to have in our diet. We can't make them, so we have to have them provided. Otherwise, we can't make cell walls which require these fatty acids in them. During flu or a cold, the blood-brain barrier may be weakened as well, and that's when particularly it's important to watch a diet. Don't eat a lot of rubbish then. But the blood-brain barrier can also be a direct viral attack. And so thiamine, essential fatty acids, vitamin C deficiencies can weaken the blood-brain barrier. And the first step of treatment should always be that a person has adequate amounts of these. But we know too in the literature that it's strengthened with blueberries, grapeseed, garlic, antiviral herbs such as echinacea and Panax ginseng. So it's in fact very foolish to think that in our diets, we have everything that can help us. Sometimes we're encountering things which we can't overcome readily, and if we have things that can assist us, they should be available to us to be able to use. Okay, so during sleep, we clear the brain. The brain takes between 20 and 30% of all the body's energy in the course of a day. It's busy thinking and expressing. It also has lots of silent thoughts going on. And we call this the mind's eye. Our mind's eye is active the whole time while we're awake. So we produce a lot of metabolites, and we have to clean these away. During sleep, believe it or not, it's a very curious thing, but the brain shrinks, and it's doing a sort of pushing out of all sorts of chemicals and things into the cerebrospinal fluid, which is the fluid around the outside of the brain. And so we then can clear that up. Until last summer, it wasn't known that we actually have a lymphatic drainage from the brain. They didn't know, but they discovered it, and it was published in Nature. So I think maybe we've got a picture, I don't know, we'll show you. The other thing is that I was saying that sleep helps to clear the brain, but also there are some very important hormonal functions that go on. During darkness, which is not necessarily sleep, during darkness we produce melatonin. And melatonin is a substance which is made from an amino acid called tryptophan. And tryptophan will make serotonin and melatonin. And melatonin is produced by the pineal gland, which is a tiny little gland, very well protected, right in the middle of the brain. And this sends information to the pituitary gland, which is just above the base of the brain and hangs in a little fossa and sends hormones around the body. And so melatonin and the little crossover of nerves above it, it's called the supraoptic chiasma, melatonin can influence that and can influence the whole body, because melatonin guides the body and says, as soon as I've gone, you can start to produce some hormones, some of the daily hormones. So melatonin is produced in darkness, and we all evolved in the dark and light of the 24 hours. So it's very difficult to avoid the conclusion that we've interfered with nature, because we have a constant light source all evening and sometimes all night, and it's very bad for us to have constant bright light. So why should all these rhythms matter? Well, when people travel from one country to another, they have jet lag, and shift workers are 20% higher risk of metabolic and cardiovascular diseases, and sleep problems, insomnia, hyposomnia, parasomnia, which can occur, but they're not all circadian, but also the feeding and fasting cycle and the moods that people have are all related to this, because we know that in the winter months people can get what's called seasonal affective disorder, when it's altogether too dark for too long. And in some countries they have to use bright lights to make them cut off the melatonin and start all the rhythm of other hormones. So this is the suprachiasmatic nucleus. It is the circadian pacemaker, but it responds to melatonin. And there are differences between people. Some people are very bright in the morning and others more late at night. And it's known that this will vary in the course of a person's lifetime. During teenage years, people sleep much later in the morning and they're more owls. So we have to be aware of that. But this tells us too that there are different diseases that can occur more predominantly at particular times of the day. And this shows that when fully alert and at midnight, there are different things which will happen. And here, blood pressure, angina, infarction, and sudden cardiac death often happen in the early hours here. During this time, people are much more aware of pain, and osteoarthritis, severe asthma can occur then. And this is all documented in the literature. It's not something that one ignores because, well, we can't. We have to gear up to looking after people at the right time of day. So melatonin is an antioxidant which is much more powerful than vitamin C, and it helps to clear the brain. It's a major antioxidant. It's helping during those nighttime dark hours to clean the brain up, so to speak. The person who's written some 600 and something papers on melatonin, I asked him how much melatonin do you take, and he said 7.5 milligrams every night, and I said yes. He said yes, rather, and so I do that too. So you have to be aware that sleep isn't just constant. There are all sorts of different stages of sleep, and here it's important to say that these can be measured, and Dr. Mus measures them, and Peter in their department. We can measure stages of sleep and see that people are having deep sleep. And when people have chronic insomnia, this is really very bad for their intellectual function. They have delayed sleep onset or insufficient sleep time or lots of awakenings and variability in their sleep pattern. So it's very important to try to make sure that one does a proper regime for sleep. So in the day, people can be sleepy or fatigued, have poor concentration and tenseness and irritability. It's not unitary, as I said, sleep. And we have cyclical, what are called roving eye movements, and in the sleep phases. And during increasing age, there's a change in there's less deep sleep, which is stages 3 and 4, and more light sleep and more arousals. So I think it's very important to be aware that one has to have a proper sleep hygiene, which includes doing exercise, diet, not having caffeine late in the evening. Don't use alcohol as a hypnotic, and make sure that the bed and mattress is comfortable, with good temperature and good ventilation. And people can adapt to noise unless it's very intrusive, so no loud noises. And all 5 stages of sleep are critical for normal function, and there are risk factors when the rhythm is not right. And here we did an analysis of, I don't know how many patients, Paul, but sad, I think it's, anyway, we did an analysis of our patients, and we found that a lot of them have seasonal affective disorder in the winter. They have more problems with mood. So here I was saying is that Alzheimer's is considered to be this substance, ApoE, and the other one, tau, will produce beta amyloid precursor protein, and that will produce the amyloid. And it's a chronic breaking down to building up imbalance, which is a feedback mechanism. So this is it depicted in one slide, even though that's rather simplistic. I'm going to say a few of the things here that is a risk factor, and infections are. There's a chap called Alan MacDonald who is a pathologist, and he was denied the opportunity to study some of the things that he wanted to study for a long time. So when he retired, what he did was to get permission to analyze and look at brain samples from the Alzheimer's brain bank in the States, and working in his own laboratory, which is in his own space, he had looked at the brains of patients with Alzheimer, and he found Borrelia, which is the causative organism for Lyme disease, in the plaques in the brain of patients with Alzheimer's. And here it is, he's shown here, Borrelia burgdorferi, everything that is stained green is the cell, and he's found that the Alzheimer's plaque stained with a particular different stain there, and he found the actual Borrelia organisms, the DNA, which is the genetic material of them, inside this. And he says that Alzheimer's plaques resemble a biofilm community, and this means all sorts of different organisms that are around the Borrelia organism. And he's found that the Borrelia biofilms dwell inside the amyloid plaques. Whether we've put these plaques around them in order to try and wall them off, or quite what we've done, that's happened. And he found this in every brain sample that he studied. So we have to think about infections. So oxygenation and mitochondrial function. We need oxygen for the brain to function. We need oxygen for every metabolic process. And here, the balance between carbon dioxide and oxygen is being measured. And it's that which is in the soft tissues, not necessarily what's in the blood vessels, because what's in the blood vessels is going around a whole circulation. And the blood vessel cell walls have got to make a decision as to whether to deliver the oxygen to those tissues nearby or not. If they decide, yes, I better deliver the oxygen, then they will unload their oxygen. And Dr. Julie describes this as a sort of delivery lorry, unloading things. But if there is no need for the delivery lorry to unload there, because nothing is happening in that area, there's no lactic acid production or anything in the tissues, and lactic acid is produced when a person has some metabolic activity, then it'll take it a bit further on because it might be needed somewhere else in the body. So in some patients, you will see that they're not blue. There's nothing wrong with their lungs collecting oxygen, but they can still have very poor oxygenation of the tissues, including the brain. So it's very important to be able to assess the level of oxygen, and this can be done by measuring transcutaneous levels of oxygen and carbon dioxide. So now if we go on to another thing that's important, when people have apnea, you may have heard of this. This is when people have a disordered breathing during sleep. When they, you'll hear this story quite often, which is that somebody is sleeping soundly and then they go, it's sort of quite a sudden intake of a lot of breath, because they've had a period when they weren't breathing, and then the brain stem says, come on, wake up and breathe, and then the person has to take a lot of breath to make up for having had not enough oxygen. And this is one of the things that was checked by Bredesen, whom I told you had corrected Alzheimer's in his group of patients. He always checked for sleep apnea. He checked for correct oxygenation in the tissues. And he recommended that people wore what's called a CPAP machine, which actually pumps oxygen into the lungs during the night. But that's a very elaborate piece of equipment, and it's disturbing to have a mask on the face, but it can correct sleep apnea. However, one can do this in a different way. If you go and see Mus and Peter, they will measure the transcutaneous oxygen, and if it's low, if the oxygen is low when you're lying down, you can actually pep it up. And you use a machine like this, an oxygen concentrator, to separate out oxygen and nitrogen in the air and give you more concentrated oxygen to breathe. Now, there are portable ones. This is one that we've got at the hospital. But what one can do is to use this in the evening before people go to sleep. So even if they have got less oxygen, but because they've got apnea in the night, they've still got more oxygen in the tissues that will help to keep them going through the night, and they won't be severely deprived. So the other thing that we have to be aware of is that in the brain there are mitochondria, which are little tiny organelles in our cells that are involved in the body's energy production, and they can be very disturbed from oxidative stress because they don't like too much oxygen and all sorts of pollutants and environmental agents. And they're responsible for energy production using oxygen, and it's a lot of reactions that are occurring. And we now know that there are things that could correct it. So this talk is actually some of the corrections as well as the risk factors. There's a particular substance called pyrroloquinoline quinone, PQQ, which will make new nerve cells. They used to think there's no such thing, and that's not true. It's possible. It can make new mitochondria, and it can attack the degenerative processes and protect the brain from these neurodegenerative diseases. And it can rejuvenate mitochondrial function. And when given to people, they've had gait disturbances which have been corrected. There's an inflammatory marker which we look for. It's called C-reactive protein and interleukin-6. And if you give people PQQ, this just drops. And it's also got nerve growth factor potential because it produces a thing called nerve growth factor in cells, which supports the nerves. And it heals injured nerves. So there's one particular person I'm thinking of who has had PQQ in very high doses for a period of 3 months, and intellectual function has become much better, much less anxiety. So it's been quite a dramatic change. It can reduce inflammation, and it stops the inflammation molecules going there, and it protects the brain against what's called excitotoxicity from glutamate stimulation of the brain cells, and it protects the brain against the damage caused by high blood sugar. People with diabetes are 60% more likely to develop dementia. And Alzheimer's is sometimes referred to as type 3 diabetes. So 100 milligrams of PQQ reversed brain damage in diabetic mice. Obviously, we haven't got the opportunity to look at samples of brain, but we can look at function. And in Parkinson's, the abnormal protein that deposits in the brain, called alpha-synuclein, is toxic to brain tissue, and it prevents the formation of these cell-killing fibrils. So it protects against oxidative damage, hyperexcitation, and glucose-induced brain damage. And the damage to the brain cells from high blood sugar, I think we've said all this. In lab studies, this particular substance reduced ischemic damage after a stroke even. And it improved neurobehavioral scores after a stroke. It inhibits malformed brain proteins, and when put into cultures of brain cells, it can revive the dying cells. So it reversed the toxicity of beta amyloid proteins and prevented the death of brain cells, reducing the oxidative damage. So we have to think more broadly in terms of diet, lifestyle factors, exercise, smoking, hormonal status, the balance of nutrients, proteins, fats, carbohydrates, vitamins, minerals, exposure to pollutants, and stress. And we keep being told that we can't alter anything because we're sort of guided by our genetic makeup to our fate. But we can influence our genetic performance by diet. So some of these risk factors and protective factors are listed on this slide, and it's from Calabrese, Vittorio Calabrese in Italy, and he said that you can think about this genetic thing, it's called ApoE, and other genes linking to obesity and hypertension and high blood fats and also infections, and it'll lead to neuronal damage and dementia. But you can do diet, education, physical activities and social activities, and you can do other things which will reverse this, but an unhealthy diet and alcohol and smoking and diabetes are major risk factors. Thank you very much.